Hi, everybody. This is Dr. Brett Talley Daniel, MD. I'm a neurologist and headache doctor, and today I'll be talking about does Ubrelvy, the generic is Ubrelvy, work for acute migraine treatment. It's a new drug that's out. It's now very clear clinically that the neurochemical CGRP has a lot to do with migraine. The three CGRP antibodies released in 2018, Ubrelvy, Aimovig, and Emgality, have worked well and nearly miraculously for migraine prevention simply by taking a small subcutaneous shot once every month period. These CGRP antibodies can be freely taken with any other drug and have no FDA contraindication limiting their use. They also have a very low side effect profile, making them easy for patients to use long term. Side effects are mainly a small injection site reaction like a bruise one gets with blood drawing with all three drugs, muscle spasms, and mild constipation with Aimovig. The results from using CGRP antibodies for migraine prevention were the thing. The results were like nothing ever seen before. 50% of patients had 50% reduction in migraine occurrence. Another 25% had 75% reduction, and the remaining 25% had unbelievable 100% reduction in migraine. Never saw anything like that. I would see bad migraine patients come to the office reporting no migraine at all in the preceding months when last seen, something I'd never seen before practicing neurology. The CGRP antibody drugs have no conflict with patients with coronary artery disease or stroke, although triptans like sumatriptan have a contraindication of those drugs, and you can't use them then. So the question is, does Ubrelvy work for acute migraine treatment? Well, 20% of patients treated with Ubrelvy at onset with an oral dose of 50 and 100 milligrams had freedom from headache pain at 2 hours. The FDA approved Ubrelvy for acute treatment of migraine. What is the indication of Ubrelvy? It's a calcitonin gene-related peptide, CGRP receptor antagonist for the acute treatment of migraine with or without aura in adults. It is not indicated for the preventive treatment of migraine. What drugs should not be used with Ubrelvy? Drugs that are contraindicated are the strong CYP3A4 inhibitors, ketoconazole, itraconazole, and clarithromycin. What are the common reported adverse reactions? Adverse reactions are nausea, dry mouth, and somnolence. What's the doses and administration of the drug? The recommended dose is 50 or 100 milligrams taken at onset of migraine headache. The 50 milligram dose should be first tried, with the second 50 milligram dose may be given 2 hours after the initial dose. The maximal dose for a 24-hour period is 200 milligrams. These drugs are called GPANTs in the neurology headache literature. That's spelled GEPANTS. Special populations are a consideration for use with pregnancy. There are no adequate data on the developmental risk associated with the use of Ubrelvy in pregnant women. Lactation. Also, there are no data on the presence of Ubrelvy in human milk and effects of it on breastfed infant, or the effects of Ubrelvy on milk production. The developmental and health benefits of breastfeeding should be considered, along with the mother's clinical need for Ubrelvy and any potential adverse effects on the breastfed infant from the drug. All right, pediatric dose use. Safety and effectiveness in pediatric patients has not been established. Geriatric use. In pharmacologic studies, no clinically significant pharmacokinetic differences were observed between elderly and younger subjects. Hepatic impairment. No dose adjustment is recommended for patients with mild or moderate hepatic impairment. Dose adjustment is recommended for patients with severe hepatic impairment. Renal impairment. No dose adjustment is recommended for patients with mild or moderate renal impairment, but dose adjustment is recommended for patients with severe renal impairment. Possible benefit of this drug for acute migraine therapy. Only about a quarter of patients use a triptan at onset for migraine treatment. Use of triptans is limited by insurance coverage, expense, and triptan side effects, which limit their use. And these side effects are chest tightness or pressure, near fainting, neck back pain, which may be burning, warm, or hot, dizziness, or drowsiness. Unfortunately, these symptoms limit triptan use. Another problem with triptans is they can cause vasoconstriction of arteries, and thus they are contraindicated with angina, coronary artery disease, previous heart attack, high blood pressure, or stroke. Ubrelvy has no effect on vasoconstriction, which is okay with heart or stroke conditions. Also, triptans successfully treat migraine in 78% of patients, and the gepant Ubrelvy may help in this population of poorly treated patients. I have some comments from the American headache specialists in America. So Richard Lipton, MD, a co-author of the study mentioned here on the use of Ubrelvy, and the director of the Montefiore Headache Center at Albert Einstein College of Medicine, he did the original work on the drug, stated, quote, triptans activate serotonin receptors and constrict blood vessels. Gepants block CGRP receptors and do not constrict blood vessels. They will be the most useful in people who do not respond to triptans and have side effects limiting triptan use. It's triptan sensations such as chest pressure, diaphoresis, flushing, or who have cardiovascular contraindications are precautions restricting the use of triptans. And these include cardiovascular events such as myocardial infarction and stroke, cardiovascular conditions such as angina, claudication, or ischemic colitis, are multiple cardiovascular risk factors. The side effects of the gepants looks very favorable. Kathleen Dirge, professor of neurology and ophthalmology and chief of the division of headache and neuro-ophthalmology, University of Utah School of Medicine, and last year is president of the American Headache Society, which would have been 2019, said the expected upcoming addition of ergogepant to the neurologist armamentarium opens up new targets for us to be treating patients. And she hailed the therapy as, quote, another designer drug for migraines. Altogether, the variety of new drugs for migraine treatment means I've got more tools in my box than I ever had, end quote. Andrew Hershey, MD, PhD, endowed chair and director of the Headache Center and Division of Neurology at Cincinnati Children's Hospital Medical Center, said ergogepant presents a new class of acute treatment for headaches in patients with migraine. Although CGRP antagonists have demonstrated efficacy compared with placebo, it's not known which role they will play compared with triptans and over-the-counter remedies, largely non-steroidal and anti-inflammatory drugs, end quote. Stuart Tepper, professor of neurology at the Geisel School of Medicine at Dartmouth and director of the Dartmouth Headache Center, said, quote, the advantage of this drug and its cousin, rimegepant, is the side effects are really minimal. Those of us in headache medicine are comfortable and ready for FDA approval. He said that in his practice, hardly any patients would have contraindications to the gepants class of drugs. In fact, he suspected ergogepant could work even better in real life than in the trial because patients may take it early in a migraine attack. The last little comment here is from Dr. Yula Orlova, MD, PhD, a headache specialist, and assistant professor of neurology at the University of Florida College of Medicine in Gainesville. And she said, quote, with migraine being a chronic disorder characterized by recurrent headache, the study based on a single attack could not adequately validate the drug's safety and frequent use over an extensive period. Earlier generations of drugs used to treat an acute migraine attack pose the challenge of medication-overuse headache, also known as rebound headache when taken too frequently. It'll take some time before we can answer the question if ergogepant also carries the risk of medication-overuse headache. In the meantime, we will still need to be very vigilant if patients will be taking this medicine very often and for longer periods of time. This ends my talks on this subject here today. Does ergogepant work for acute migraine treatment? Please click subscribe down there. Follow me on Podbean and Spotify for other talks I have on migraine, and my webpage at Dr. Migraine, www.drmigraine.com. God bless all you persons who have migraine, and I will see you on the next talk.